My guest is Dr. Howard Conn, who is a laser cosmetic surgeon in Irvine. He specializes in eyelid surgery. Thanks for coming, Howard.
Thank you.
You know, what happens when we age? What happens around the eyes here? What is going on? What's the process?
Well, when people get older, 30s, 40s, 50s, they tend to develop loose skin around the lids, and also there's sun damage, which will cause wrinkles around the eyelids. Also, there's a great hereditary component where no matter how much exercise that a person does, they'll look tired because somebody in the family had some bags under the eyes, which is fat that's come forward.
So the fat's there all the time. It's not that the fat is deposited as we get older, but you have this fat here and it just comes to the surface. It's deeper down.
Yeah, I think the fat will come to the surface, and also the overlying tissue will tend to thin out, which will cause the fat to have the appearance of puffiness.
Okay. And the darkness under the eyes, what causes that?
Well, the darkness can be a combination of things. It can be fat that's come forward. It can be pigment on the surface that we address with some of the lasers. And it also can be actually loss of fat in the inner portion of the lower lid. And with that, we actually fill that with material.
I see. So as an ocular surgeon, this is your whole bailiwick. You specialize in this. You've been specially trained in this, unlike other cosmetic surgeons who may do just general cosmetic surgery. This is what you really focus on.
Yeah, my specialty is eyelid surgery, and I have trained in general surgery, but also I'm board certified in ophthalmology and have fellowship training in just the ocular plastic surgery. So that's basically what someone with my training does all day, is eyelids and related things.
So what happens, explain to us, what happens during the eyelid surgery?
Well, I prefer to use the laser for these procedures, and I'll just show you an example of a patient who had surgery of the upper and the lower lids. And we do these in the office with local anesthesia. We cover the skin with some ointment to numb it up, so when we give the local anesthesia, the patient doesn't feel the local. And we place protectors over the eyes, and instead of using a scalpel, we use a laser to make the incision. And this is a diagram of the kind of procedures that we do where we remove skin and fat. So we draw a line where I want the lid crease to be, a second line to include the redundant skin. And instead of using a scalpel, we use a laser, and this is a handpiece for a CO2 continuous wave laser, and it makes a tiny little beam of light, and this beam of light will seal the blood vessels as it cuts. So that's the advantage over a scalpel, that there's not bleeding. So the surgery is done faster and people have usually very little bruising.
Now, we recently went to your office and we're going to show some patients that you did the procedure on.
Hello, how are you?
Hi, nice to meet you.
Bonsoir, bonsoir,
Yes. I'm hoping to look like her when I'm
Yeah, isn't that terrific?
Yes, wow.
Good.
Good job.
So would you like to come with me?
Yes, please. See this?
Yeah.
Okay, now if I pull it, oh, it can get really bad sometimes.
Right,
So.
okay. So let me take
See,
a
it's
look.
just starting, but I'm getting...
So let me take a look right here. With the upper lid, we draw a line right here,
Okay.
and the second line to include some of the redundant skin. And then I use a laser with a 0.2 millimeter spot size. It's a little beam of light that cuts, and it seals the blood vessels as it cuts, so there's no bleeding. And then we close that with sutures. And the sutures stay in for about 1 week.
How much can you get rid of on this?
Okay. Well, let me just show you in the
Okay.
mirror. With that, I would not surgically take any skin, but I would use this laser to tighten up the skin. And I'll show you that laser in just a second.
Okay.
The other thing is, you have this line right there, and you see that little kind of it's like a little dent right there.
Yes.
With that, I fill that with some Restylane. You can see how it softens that up. You mentioned Photoshop, and it looks like a Photoshop.
It sure does.
But this is what
Right,
I've
you
done
skip-
with her, because she had a really deep line right there. I'll just show you how this works. There's some areas that are not treated, so those little cells will seal up the tiny little holes.
Okay.
And that's the whole key. So that's the story.
All right, thank you, Dr.
Oh, you're welcome.
I look forward to looking better.
Oh, thank you. You already look better.
No, it looks like, I mean, you have, with the laser, that you have less bleeding, so you have less bruising, I guess, and so you get back to work faster. And the other laser that you demonstrated there was the Fraxel, right?
Right.
And is that what you have on the table there?
Right. The other modality of lasers that are used in eyelid surgery have to do with tightening the skin and reducing the brown spots. And there have been other lasers throughout the years that have done this, but the present modality is called the Fraxel laser, and this is the handpiece that where the energy is applied. The machine is attached to this disposable handpiece, and the laser, we glide the laser over the area that we're treating. It can be the eyelids, the face, hands, neck, chest, and it puts tiny little spots of energy in, and the adjacent skin will seal up those little holes, so the healing takes about 48 hours. And so there's less risk of infection with this procedure.
So you're saying to me that years ago when they did with, well, I guess they still do it that way with traditional cutting and stuff, their downtime would be quite extensive, wasn't it, after?
Well, when I used a scalpel, I used to tell people, and I used a scalpel from about 82 till 92, and I've used a laser since about the early 90s. And I used to tell people to expect to be bruised for several weeks.
Wow.
And now I tell people 3 or 4 days.
Huge
So
difference.
there's certainly the downtime advantage. Then the other advantage is this technology of shrinking the skin with these fractional lasers, because in the old days, which was not that long ago, 10, 15 years, all we could do was pull the skin. So we can now address the sun damage element where the skin can be tightened at the same time. And all these are done with local anesthesia.
This is a quantum leap in improvement. I mean, compared to what you described before. Can you do the upper and lower at the same time?
Everybody's different, and sometimes people need just the upper, just the lower, sometimes just resurfacing. So everybody's different, but we'll often do the upper lid surgery, lower lid, where we remove a little fat from the lower lid, and the laser tightening all at the same time, and that combination takes about an hour.
So you can get rid of the droopy eyelids up here, get rid of the wrinkles on the side, get rid of the puffiness underneath in an hour.
Yes.
And get back to work in?
Well, 3 or 4 days usually.
Wow.
The sutures in the upper lid stay in for about a week. There are no sutures in the lower lid, and of course with the laser tightening there are no sutures there also.
That's amazing. So this is really, it sounds like your business is only going to grow as we all get older, and not that it's simple to do. I would think that there's not too much room for error here, and I would think that somebody wants to really work on their eyes, they should see somebody who's trained in ocular surgery like this. But this is really fascinating that you can get back to work so quickly and work in all these delicate tissues and get such a great response. And I know you've been a pioneer in this. You've been doing this for many.
Well, I started
years.
using lasers when I was at Johns Hopkins in 1978. I've worked with laser companies to help develop some of these. So it's a lot of fun to have these new devices that actually work and are safe.
Wow. Well, we're running out of time now. That was very interesting, and I appreciate you coming on, and I think a lot of people are going to seek out your expertise.
Thanks for having me.